8 fatal remedies for those over 50 years old. As we age, our body undergoes transformations that require special attention, especially when it comes to medications. Why are muscle relaxants, often prescribed for pain relief, potentially a double-edged sword for long-term health? How can something as beneficial as calcium supplementation paradoxically increase the risk of cardiovascular and renal problems? And finally, what safe alternatives exist for those seeking relief from anxiety and stress without the associated risks of kawakawa and other anxiolytics? In this video, we will explore the lesser-known side effects of popular drugs and supplements and how they can be especially dangerous for the older population if not used correctly, potentially leading to death. Join me to discover the 8 fatal remedies for those over 50 years old. The penultimate remedy will surprise you. A very important warning. You need to promise me that you will not stop your treatment just by watching this video. If a doctor has prescribed the medications, it is essential to follow their recommendations. Ideally, discuss with them the possibility of other options. On the other hand, if you are self-medicating, it is important to emphasize that this practice is not recommended. With that said, let's begin. Number 1. Anti-inflammatory drugs. Drugs known as anti-inflammatories, including diclofenac, ibuprofen, nimesulide, and meloxicam, are essential for treating pain and inflammation. Despite their effectiveness, prolonged use of these drugs requires caution due to possible adverse effects. For example, after 5 days of continuous use, there is an increased risk of developing stomach ulcers, as these medications can compromise the stomach's natural defenses against acids. Are there other negative effects? Yes. They can negatively influence blood pressure and kidney function, especially in individuals with a history of hypertension or kidney problems. Changes in kidney filtration and increased blood pressure are significant concerns, underscoring the need for monitoring and conscious use of these anti-inflammatories to avoid complications. Number 2. Calcium supplementation. Calcium supplementation, widely adopted worldwide, should be approached with caution due to the risks associated with its isolated consumption. Studies indicate a significant increase in the risk of nephrolithiasis, the formation of calcium oxalate stones in the kidneys, a painful and potentially serious problem. Moreover, excess calcium not only adversely affects the kidneys, but also contributes to the calcification of arteries, a process that hardens and narrows the arteries, raising the risk of cardiovascular complications. To mitigate these risks, it is crucial to incorporate other essential nutrients in the diet or supplementation. Combining calcium with vitamin D, vitamin K2, and magnesium is essential for bone and kidney health. Vitamin D facilitates the absorption of calcium, while vitamin K2 activates proteins that regulate its distribution, preventing deposition in undesired locations like kidneys and arteries. Magnesium maintains the calcium-magnesium balance, preventing imbalances that could lead to kidney stone formation and arterial calcification. This holistic approach not only promotes bone health, but also protects against renal problems and arterial calcification. Therefore, when considering calcium supplementation, it's important not just to focus on calcium itself, but also ensure an adequate intake of vitamin D, vitamin K2, and magnesium, as guided by a healthcare professional. This balanced strategy is key to maximizing the benefits of calcium supplementation, minimizing the associated risks. Number 3. Sleeping pills. Benzodiazepines, such as diazepam, clonazepam, alprazolam, and promazepam, are known for their ability to induce sleep, acting directly on the central nervous system. But why are these medications dangerous? Although effective, these drugs present significant risks, especially for individuals over 50 years, due to the increased risk of falls and fractures, a concern aggravated by the prevalence of osteoporosis in this age group. Furthermore, prolonged use can alter the natural phases of sleep and impair memory, compromising cognitive health. Given these risks, it is advisable to adopt sleep hygiene practices, such as maintaining a regular rest routine, minimizing screen exposure before bedtime, and creating a calm and comfortable sleep environment. These measures aim to promote proper and restorative rest without the side effects of medications. Opting for natural strategies and lifestyle adjustments to improve sleep quality is a safer and more sustainable approach, especially considering the potential risks associated with the use of benzodiazepines. Number 4. Anti-allergics. It is vital to consult a doctor before using medications, particularly first-generation anti-allergics, such as diphenhydramine, chlorpheniramine, and hydroxyzine. These are commonly sought by people over 60 years old to treat allergies and cough, but come with a range of side effects, including dry mouth, constipation, urination difficulties, and notably, drowsiness. The latter can be especially dangerous when medications are taken during the day or before driving, increasing the risk of falls and accidents. Moreover, these anti-allergics have a range of applications, such as in the treatment of motion sickness, requiring a clear understanding of the associated risks and the need for caution. Therefore, the importance of following medical guidance cannot be understated, ensuring the safety and effectiveness of treating allergic conditions and other symptoms. Number 5. Muscle relaxants. Responsible consumption of muscle relaxants, under medical guidance, is essential to avoid complications and ensure user safety. Medications like carisoprodol and baclofen, though helpful in relieving muscle tension, should not be used without professional evaluation. Ignoring the risks associated with self-medication can lead to concerning side effects, such as intense drowsiness, which interferes with the ability to perform daily activities and increases the risk of accidents. Other problems, such as dry mouth, constipation, and urinary retention, are also common, in addition to rare but serious changes in blood tests. Drowsiness, in particular, can be dangerous, especially when it affects the ability to drive or perform tasks that require attention, and its residual effect can compromise well-being the following day. Therefore, it is crucial to seek medical guidance before starting the use of muscle relaxants, avoiding self-medication and its consequences. Awareness of the effects and risks of these medications promotes safer and more effective treatment, minimizing the potential for complications and ensuring patient health and safety. Number 6. 5-HTP supplements. Also known as 5-hydroxytryptophan. 5-HTP is essential for the production of the neurotransmitter serotonin, and the hormone melatonin is vital for people over 50 years old, offering notable benefits in treating anxiety, depression, and sleep disorders. Serotonin and melatonin play crucial roles in relaxation and in regulating the sleep cycle, significantly improving quality of life. However, aging brings challenges, such as increased inflammation due to the accumulation of senescent cells that release inflammatory substances, raising the risk of chronic diseases. This inflammatory condition alters the metabolism of 5-HTP, potentially resulting in the production of quinolinic acid, a neurotoxic compound. Therefore, it is crucial to assess inflammation levels before starting supplementation with 5-HTP to avoid adverse effects, especially in older individuals, emphasizing the complexity of nutritional supplementation and the importance of personalized strategies for maintaining brain health. When considering the use of 5-HTP, it is essential not only to understand its potential benefits for mood balance and sleep quality improvement, but also to recognize the risks associated with its conversion into harmful substances in contexts of chronic inflammation. This knowledge highlights the need for careful monitoring and specific tests to identify inflammation before opting for this supplement, aiming to optimize its positive effects while minimizing potential harm. Thus, 5-HTP supplementation presents a dual facet. On one hand, it promotes mental health and well-being by facilitating the production of essential compounds for relaxation and sleep. On the other, it requires a meticulous evaluation of the risks due to the body's inflammatory state, especially in old age, to ensure that its benefits are achieved without compromising neurological health. Number 7. Multivitamins. Indiscriminate consumption of multivitamins can bring more harm than benefits, challenging the popular belief in their harmlessness. These supplements, rich in vitamins like biotin, vitamin B7, can trigger an imbalance in nutrient absorption and significantly interfere with medical test results, especially those related to the thyroid and tumor markers. Many patients, without any symptoms of thyroid disease, end up showing changes in TSH and free T4 tests due to the use of these products, especially those formulated for hair and nails. This situation can lead to misdiagnoses, emphasizing the importance of transparent communication with healthcare professionals about the use of these supplements. Doctors, in turn, often recommend temporarily stopping these multivitamins before diagnostic tests to avoid false interpretations. Awareness of these interactions reinforces the need to approach the consumption of vitamin supplements with caution, avoiding self-medication and ensuring that medical treatments and diagnoses are based on accurate and reliable information. The practice of informing the doctor in advance about the use of any supplement is crucial to ensure the accuracy of laboratory tests and avoid unnecessary disturbances for both patients and healthcare professionals. This care allows for a more precise clinical assessment, avoiding the risk of medical interventions based on test results altered by external substances. Thus, while multivitamins may offer benefits under specific conditions, their use should be carefully considered and accompanied by medical guidance, especially in contexts where they may influence the interpretation of critical health tests for the patient. Number 8. Kawakawa. Kawakawa, also called kava in certain South Pacific cultures, is a traditional drink used in significant events such as weddings and major festivities. Its popularity stems from a tranquilizing effect reminiscent of alcohol, providing relaxation without the risks associated with alcoholic beverages. Containing psychoactive substances known as kavapyrones, kawakawa offers an alternative for those seeking to relieve tensions and anxiety naturally. However, the use of this drink, like alcohol, requires caution, especially when considering its impact on long-term health. The comparison of kawakawa to alcohol is not limited to perceived benefits, but extends to potential health risks, including the issue of liver toxicity. This risk is particularly relevant for individuals over 50 years old, whose natural liver regeneration capacity decreases with age. Prolonged consumption of kawakawa, especially in combination with other toxic substances such as anti-inflammatory drugs and painkillers, can lead to serious liver damage, a concern that should be considered by those seeking in kawakawa a solution for stress and anxiety. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.